Welcome back at 7:44. Time now for Behind the Badge. Earlier this month, Metro Police reported 5 suspected fentanyl-related overdose deaths over a 24-hour period. Now, the rise in overdoses is a trend that police and doctors say they're seeing in the community. Metro Sergeant Miguel Garcia and Lieutenant Brandon Clarkson both join us now to discuss some of these ongoing efforts by police to bring these numbers down. This is so bad, Sergeant Garcia.
Well, good morning, Alyssa. Thank you for having us. And like you said, this is really bad. We don't want people to think that fentanyl is something that's going to go away. It's not. It's here, and it's extremely dangerous. And that's why I have with me here today Lieutenant Brandon Clarkson from our narcotics division to give us a little more insight of what's going on the streets. Yeah, so
tell us, Lieutenant, what's going on? We know there have been a lot more overdose deaths throughout the pandemic, and 5 overdose deaths just from fentanyl in a 24-hour period this month. I mean, that is really concerning.
It is very concerning. I mean, we've seen a significant increase from 2019 to 2020, specifically a 200% increase in fentanyl-related overdoses. And I can tell you from January this year to July, we've seen another 39% increase in fentanyl-related deaths. So It's very alarming.
Yeah, and we know that last year everybody was stuck in the house, and while we may not have exact details as to why there were more overdose deaths, we would have to imagine that isolation had a lot to do with that. The isolation part of the pandemic, for the most part, is over. So I'm just wondering why it would still continue to be on the rise now this year.
Well, I think when there's a demand for illegal narcotics, controlled substances, there's always a supply. So I think the issue that we're seeing is the availability on the social media and drug dealers providing these pills to people. That's the alarming rate, especially our younger crowd, which are on social media. They're looking to get a high, and unfortunately, they don't realize what they're taking. They think they're taking a pill, a Percocet, a Xanax, or something that's not laced with fentanyl, and they end up dying because of it.
Geez. Yeah, fentanyl, there have been many reports just how deadly it is. What are you guys doing at Metro to try and get fentanyl off the streets?
So there's a lot of things that we're trying to do. There's enforcement efforts, and then I think there's our engagement efforts. So enforcement efforts is that we want to track down anyone that is selling drugs or any illegal substances, talking to the community about this. And part of the reason, having this conversation today is just to make people aware that this exists. And what we see is with the youth and the casual drug user, they just don't know what they're doing. They don't know what they're taking. They think they're going to get high. They get this from a dealer or social media or a friend. And what I want parents and the youth to understand is that if you take a pill that's not prescribed to you, or go to a doctor or get it from a pharmacy, this pill could end your life because it's so readily available that it could shut your body down and kill you. And I want everyone to realize that this pill, one pill, can kill. And that's what's the dangerous part of it.
Okay. I wish we had more time to talk about this. Sergeant Garcia, if you could send us somewhere where we can get resources to help our loved ones who may be struggling with addiction.
Absolutely. There's a couple of places you can go. Go to our webpage, lvmpd.com. Go to helpful links and go to our We Care booklet, and they'll give you some information there. Or you can always just go to the Southern Nevada Health District website and get more information there.
Thank you both so much for joining us this morning. We appreciate it.
Thank you.
Thank you.
And if you have a question for Metro, send an email to behindthebadge@fox5vegas.com.